problems with your forearm like Dupuytren's Contracture or stenosing tenosynovitis or trigger finger can be really debilitating and hard to treat. These are both have to do with, adhesions in the palm and the forearm that decrease the ability for your fingers to move, right? So you commonly will see that claw type finger with both of them. And our goal as far as home care and self-treatment is to help reduce those adhesions as much as possible without creating any inflammation or aggravation. So I love using these gua sha tools for something like that. Nice soft edge, and we can address that tension ideally without doing any aggravation. So the way to do that simply is you take one of these tools and you take a little bit of olive oil, cooking oil. It could be a massage oil or cream, it doesn't really matter. We're just using it so it's a bit gentler on the skin. Next, we're going to use this tool. If you don't have one of these tools, you can use something like a Chinese soup spoon or a spatula with a rubberized handle. What we're going to do is we're going to start at the elbow, and we're going to slowly do kind of 2 chops a second from the elbow down to the wrist. And as you do this, you might feel something that feels almost kind of sandy. It feels gritty, sandy. If you find those areas, you can hang there a little bit longer. If you find a little trigger point or adhesion or a little bump, isn't painful to touch, you can stay there a little bit longer as well. And again, we're doing about 2 chops a second, working at about, my first pass, I'm usually around 3 out of 10. So I don't want it to be too strong, because if we start bearing this thing in right away, we're going to start creating more tension. We kind of have to knock on the door to be let in with this, as opposed to trying to kick the door down. So we can use that or our gua sha tool. And we don't want to spend more than 2 minutes here doing this. Again, if we find somewhere that is particularly spicy, adhesive, you feel those little trigger points, we can hang there a little bit longer. As we do a few more passes, we can go with a little bit more pressure each time till we reach about a 7 out of 10. We can also, once we're done this side, flip over to the other side, grab a little bit more of that oil, and you want to do your forearm. No surprise if you find a bunch of tension in the forearm, just because the extensors have a lot to do with the grip strength, which is always a factor in either of those problems. So again, we're going kind of, starting with a 3 out of 10, 4 out of 10, working our way up with a few passes over about 90 seconds to 2 minutes of 6 to 7 out of 10. Lastly, what we want to do is we want to address directly in the area that's sore. So often it'll be that middle finger or fourth finger where we have that finger that's a little bit stuck. So we certainly want to treat here, but we want to be careful, right? Because a lot of this is itis, synovitis. Itis is inflammation. So we don't want to do anything that hurts, right? So we can go in this palm, and often what we do is when we start in this palm, we'll see that it'll be kind of crunchy, it'll feel kind of sandy. That's all fine. As far as those kind of funny sounds, that's no surprise. But what we don't want to have is pain, right? So we're going to go in all directions in this palm. I like to work from the wrist up towards the finger. And we'll feel this little kind of, those little adhesions. And if we have an oh yes, that feels good feeling, we're going to keep going. If we have the sort of a, oh that hurts, that feels painful, or I'm not comfortable with that, we're just going to stop. When we get to this area, we'll probably find where a lot of those, where it feels kind of tough or especially fibrous with either of those conditions. Now here, we're going to work around where those really tough bumps are. And lastly, we can go right over those bumps, just to make sure that, we're treating all of that. And really we have all these fibrous adhesions. So this connective tissue is really kind of stuck together and doesn't want things to move. And so much so that the muscle is actually stuck to it as well. And so the muscle can't move independently of the connective tissue. And that causes a lot more limited movement and things get stuck a lot, right? So the tendinous sheath is stuck as well. So we want to try and free that up gently, right? So we're starting at 3 out of 10. We might move to 6 to 7 out of 10. The key to this is consistency. If we can do this every second day when you're watching a movie or having your coffee, the whole thing shouldn't take more than 5 minutes. And it's nice to have a day in between just to see how it feels. We don't want to be doing anything too strong. If anything feels worse afterwards, we've done too much. With Dupuytren's contracture, the treatment is often, getting a needle in there to break up all those adhesions, which can be uncomfortable. It's a surgical procedure, and I'm not saying don't do that, but I'm saying, is there a way we can do that a bit more gently every second day to help reduce the buildup of those adhesions? If you have any questions about this, be sure to reach out by going to chrismansbridge.com. And I would love to tell you more about this. I've had some great results with both Dupuytren's contracture and trigger finger. And unfortunately, those things take time to treat. So seeing someone in clinic like a therapist is great, but being able to do something on your own will save you a ton of money and speed up the process.